name is Tessa, and today I want to talk about health and human rights, what that means to me, and something I have come to understand more deeply through this course and also through my personal experiences. So to me, health and human rights go hand in hand. Health is not just about avoiding illness; it's about being able to live your life fully, physically, emotionally, and socially. And human rights are what protect that. So they ensure that everyone or every person have a good life no matter where they came from, what language they speak, or how much money they have the chance to be healthy and safe. So growing up in Vietnam, I saw firsthand that healthcare wasn't always treated as a right. Most people didn't go to the doctor unless something was really wrong. And annual physical exams were considered a luxury, not something regular people could afford. So I remember one time I had a stomach pain. I just walked into the clinic. They just gave me medication without asking questions. So no exam, no diagnosis. This was common. It showed how many people are left to figure things out on their own, often putting their health at risk. So when I came to US, I expected healthcare would be much better, and in many ways it is. There are more hospitals, more specialty, more options, but I quickly realized that healthcare here is still not equal. Many people, especially immigrant people of color, and those without insurance, still face barrier, or like people with like language barriers as well. I've seen people delay care because they can't afford it or they can't speak the language. They're scared to communicate, and I have seen patients treated differently based on how they speak or where they are from. That's not just unfair, it's a human rights issue. So in our course, we learn about the social determinants of health, things like income, housing, education, and access to food. These all affect how healthy a person can be. You can't just tell someone to eat better if they live in a food desert. You can't expect someone to stay mentally healthy if they constantly living in fear or working 2-3 jobs to just pay for rent. Health is shaped by the environment around us, and that's why human rights matter. So they help create the condition for good health. So another area I care deeply about is the right to make a decision about our own bodies. This includes access to reproductive health care, gender-affirming care, and mental health services. But it's also including something more personal and powerful, freedom of choice. And I hope that women around the world can learn to speak up for their bodies and decide for themselves what they want in life. No woman should feel forced to get married, have children, or live a life based on society expectation. That should only be a personal decision. I've seen too many women feel trapped because they didn't know they had a choice or they were scared to speak up. Giving women and girls the education and support to control their own future is a basic human right. And there are many real examples that show what happens when health and human rights are denied. One that really stuck with me is the Flint, Michigan water crisis. For years, many people drinking lead contaminated water because the government ignored their complaints. Most of the residents affected were black and low income. So this wasn't just a public health failure. This was a violation of their human right. Clean water should never be something people have to beg for. And another example I've been thinking about, is Ice Ray. I remember a peaceful protest in LA where people gathered to speak out against unfair immigrant enforcement. And at first it was calm, but then the government sent in heavy police presence, which created fear and chaos. So this kind of response discouraged people from using their voices, but peaceful protest is a human right, and it plays a big role in fighting for health equity, especially when the system target already vulnerable communities. So what does this all mean to me personally? As someone who hopes to work in healthcare, I believe it's not enough to just treat illness. We need to look at the bigger picture. We need to listen to people's story, understanding their struggle, and fight for the system that are fair. That means pushing for affordable care, culturally sensitive providers, safe health, and mental health support. All right, thank you so much for listening. Have a good day. Bye.